Okay, hi, I'm the supervisor.
Hi, I'm the social worker.
And today I am playing the patient.
This patient, Michael Scott, is located in room 16A. When you read this patient's chart, you're able to identify that the patient is a white male in his 70s. He has Medicaid listed as his insurance. When we attended the interdisciplinary team meeting this morning, we were notified by the nurses that the patient is alert, awake, and oriented. The patient was admitted for generalized weakness. The physical therapist at the hospital is recommending that the patient be referred to rehab to help him build his physical strength. Complete the assessment with the patient, and during the assessment, remember to inquire if the patient is agreeable to attending rehab. If so, provide the rehab facility list to him. I've highlighted all of the facilities he qualifies for based on his insurance.
Okay. Hello, Michael. I'm a social worker working for case management. I was wondering if I could ask you a couple of routine questions that we ask all patients admitted to the hospital.
Sure, go ahead.
Okay, what is the situation that has brought you to the hospital, and are you having any physical symptoms or health concerns that you're currently experiencing?
Well, for the past 2 weeks, I felt myself getting increasingly weaker. I'm having trouble walking without falling over. I've also experienced some leg pain as well. I'm 77 years old. I guess it's to be expected at this age.
The physical therapist at the hospital has recommended rehab for you. It will help build your physical strength and improve ambulation. Are you interested in being referred to a rehab facility upon discharge?
Yes, I am.
Okay, I would like to show you a list of available rehab facilities and give you the opportunity to pick which one you would like to be referred to.
Oh no, I've heard bad reviews about this first one right here. Please don't send me to this facility.
Okay, well please don't worry. It's understandable for you to not want to go to a facility where you've heard bad reviews. You can pick another one from the list, and I will advocate on your behalf that you are interested in that facility. Would you be willing to be referred to any of these other facilities on the list?
Yes, I like that one. I've heard some good reviews about Encompass, and it is also nearby where I live. It is a reasonable driving distance so that my daughter can visit me as well.
Okay, great. I will make sure to advocate for Encompass to be the facility you are referred to.
Thank you.
Of course. However, if there are limited beds at the rehab facility, you may need to be referred to a different one. Would you be willing to pick 2 other facilities that on the list that you might be willing to be referred to just in case?
Sure. These 2 right here are also okay with me.
Okay, great, thank you. I have to do some more assessment questions to ask, if you don't mind answering them for me.
No, I don't mind.
Okay, how would you describe your overall physical well-being, including your energy levels and ability to perform daily activities, including feeding yourself, bathing yourself, cooking, etc.?
I can independently do a lot of activities on my own, like feed and bathe myself. I have a cane at home that helps me ambulate, and I also have a shower chair as well that helps me bathe independently. However, like I said earlier, I am now just experiencing that trouble walking on my own without falling over. That's why I'm actually really happy to hear that I'm going to be going to rehab soon. As for my energy levels, it varies for me, and honestly, on most days I do feel fatigued.
Okay, prior to admission, did you utilize any durable medical equipment such as a walker, a wheelchair, or a cane?
As I said earlier, I only have the walker at home for right now, and it helps me ambulate. I think I'm gonna have to start using it more often going forward.
Okay, that's a great idea to start utilizing your device to walk. Do you drive?
Yes, I can drive, but I am concerned as I continue getting older, there will come a point where it would be unsafe for me to continue driving. Luckily, I do know I have my daughters who will provide that transportation for me if necessary.
Okay, great. Can you provide information about your medical history? For instance, do you have any health conditions, chronic illnesses, surgeries, or medications you're currently taking?
No, I do not have any serious health conditions that I know of. I am currently taking medication though. I am taking gabapentin 100 milligrams 3 times per day. It helps relieve that pain in my legs, and it's like a muscle relaxer for me. However, it hasn't provided any adequate relief.
Okay. Are you currently under the care of any healthcare professionals like a primary care physician?
I had a primary care physician, but he told me that he is planning to retire soon. So I am having trouble finding a new one.
Okay, I can provide you with a community medical center medical flyer. It includes information about community medical center physicians and the kind of care they provide, such as primary care, preventative care, geriatric care, adult vaccinations, COVID-19, flu testing. This is a resource you could consider and look further into if you're interested.
Okay.
There will be a website link at the bottom of the flyer. If you visit the link, it will provide additional information.
Thank you.
Okay, you're welcome. Can you describe your current living situation, including your housing stability and the people you live with?
I'm currently not facing any housing instability. I have my own private residence and the mortgage has been paid off, and I currently live alone as of right now.
Okay, do you live in a 1 or 2 level home, and how many steps are there to enter the home?
I currently live in a 1-level home. There are about 4 steps to enter. There's also a bar on the side of the stairs for me to grab onto, which is nice because it does make me feel safer entering my own home.
Okay, I'm happy to hear that. And I'm happy to hear that at home there are safety measures in place to prevent injuries. What is your educational background and employment status?
I have a bachelor's degree in education. I was a high school teacher. I taught at a high school called Forest View. However, I'm retired right now
Okay,
and I'm employed.
okay. Are there any financial challenges you're currently facing?
I do think that certain things have been very expensive for me lately, especially medication. However, luckily my daughters have been helping me pay for it. However, I'm still very concerned about this.
Okay, I can provide a flyer on available pharmacies such as Walmart, which offer medications at a lower cost.
Yes, I would love to learn about what options are out there for me to find medication at a lower cost. Thank you.
Okay, of course. If you don't mind me asking, have you experienced any recent traumatic events or significant life changes that have impacted your psychological well-being?
My wife passed away about 7 months ago, and I'm still feeling depressed and grieving her loss.
I'm very sorry for your loss.
Thank you so much.
Of course. I can provide some community resources like grieving support groups to help you process emotions and connect with others experiencing a similar loss.
Okay, I may pursue something like that in the future. Thank you.
You're welcome. How did you generally feel growing up? Were there any major traumatic events that happened during your childhood that are impacting your well-being as of right now?
I had an okay childhood. My dad was a major alcoholic and he did leave when I was around 10 years old. However, my mom was fairly supportive to me and my siblings throughout my childhood until adulthood.
Okay, I'm really glad to hear your mother was supportive to you growing up. Who are the important individuals in your support network, such as family members, friends, mentors, and do you mind sharing any potential stressors you may be having?
I have 2 adult daughters and I have 5 beautiful grandchildren as well. Despite the fact that I live alone, my family is very involved in my care. It was unfortunate that this has happened to me, but they have supported me throughout this time. My eldest daughter even says she plans to move in with me soon with my granddaughter. She says she wants to provide me company and look after me at home. If I need help with walking or cooking or cleaning, she said she's going to be there to help me. I met the only family member who has ever stressed me out was my sister. She never listens to me and is very stubborn.
I'm happy to hear that you have family in your life who are there to support you. I also think it's great that you'll have the opportunity soon to be spending plenty of time with your daughter and granddaughter. That's something to look forward to.
I think so too.
Do you have an advance directive or living will?
Can you remind me exactly what that is again? I have heard of that. However, I'm not 100% sure. Can you please tell me what that is?
Sure. A living will is a legal document and it explains how your medical affairs must be handled if you are ever unable to make medical decisions on your own. Do you remember making a living will?
No, I don't, but it sounds like a good idea. I think I plan to make one soon.
Okay, great. I just want to clarify your preferred discharge plan is to be referred to Encompass, correct?
Yes, it is. I can't wait to get out of the hospital. I hate being in the hospital.
I understand that that's a normal feeling that many patients experience. However, to ensure your safety and well-being, it's best to wait until you have been medically cleared before being discharged home. Are there any interests or activities that you enjoy doing, like reading or a TV show you like to watch? It's a good idea. Oh, sorry. It's a good idea to spend your time doing something you like in the meantime while you're waiting to be discharged.
I definitely agree with you. I've just been sitting here watching TV all day and it's been getting boring and I can't take it anymore. I think I may try reading. I do love to read, especially books about nature and birds. I think that's a really good idea. I may ask my daughter to bring home some of my books.
Oh, great. That sounds like a good idea. You should utilize your interest as it can make the time go by faster. Okay, those are all the questions I had for you today. Part of my role is to make sure the patient is linked to any services or resources needed before they are discharged. So if you think of anything else, don't hesitate to ask. And a nurse will notify the social workers, either I or someone else, and we'll come back to speak with you if necessary.
Okay, I'll keep that in mind.
Okay, great. You have a good day.
You as well.
Thank you.
Bye.